Here today. Sorry last week was out, but we got a lot of things to talk about this week, obviously catching up. You probably hadn't seen this many people at the press conference in a long time. It's because we have some of our medical healthcare providers. Certainly they're here to give some remarks that I think are going to be important for our community as we continue to see COVID coming back in some different ways. I did just get Casey gave to me before I came up here. So we are at new highs starting from Saturday, Sunday into Monday, from 311 to 320 to 322 in our hospitalizations. So again, the men and women that will be coming here are operating our hospitals here locally, and they have some words that they would like to be able to give to you. We will allow some time here for them to give remarks, and then you to ask questions, and then we will handle other city business. But I will start off with Chandra Smiley from Community Health coming forward. Chandra, if you come forward.
Good morning. Over a year ago, the five of us stood before you sharing information regarding COVID-19. We offered up testing, education on the CDC guidelines, and what we knew about the virus at that time. The only option in protecting yourself and your loved ones was to give you a mask, encourage hand washing and social distancing. We stood before you in solidarity then and remain united today in fighting this virus. However, today's message is quite different than before. Although we continue to urge you in practicing good hygiene and follow the CDC guidelines, we're here today to state how important it is for your health and the safety of our children and the community to get vaccinated. Last year it was our elderly and medically compromised who are most vulnerable. Today it is our children. Currently there is no vaccine yet approved and available for our children under the age of 12. As we embark upon another school year, I am gravely concerned about the health and safety of the children in our community. And as we wait for a pediatric vaccine, for those that are eligible, we encourage you to get vaccinated. Over 166 million Americans, or 50.1%, have been fully vaccinated. 49.6% of Florida residents have completed the series. And recent data reflects that Escambia and Santa Rosa counties are at 46%. Although great strides have been made, there is still more work yet to be done. The COVID vaccines are safe, they are effective, and they reduce your risk of serious illness. This week, Community Health will be holding vaccine clinics. On Mondays, Wednesdays, and Fridays from 9 to 1, we'll be at Brownsville Community Center offering the Moderna and Johnson & Johnson vaccines. Thursday, August the 12th from 3 p.m. to 5 p.m. at 12th Avenue Pediatrics located at 2510 North 12th Avenue. We'll be offering Pfizer and Johnson & Johnson. On August the 13th, we'll be at Airport Pediatrics located at 5868 Creek Station Road offering Pfizer and Johnson & Johnson. And then on Saturday, August the 14th at Dixon School of Arts and Sciences located at 1201 North 8th Street, we'll be offering Pfizer and Johnson & Johnson. Additionally, there are several different ways in which you can locate where to get a vaccine. You can go to vaccines.gov, you can go to floridahealthcovid19.gov, myescambia.com, or the City of Pensacola's website to find a vaccine locator. This past Saturday, in partnership with County Commissioner Lumen May, we hosted a back-to-school Vaccine Dash event at the Brownsville Community Center. One of our participants, Jonathan Douglas, age 15, when asked, why encourage others to get the vaccine, he simply said, get it so we can get over it already. In closing, I want to thank our area hospital leaders, Gay Nord, Scott Raynes, Mark Faulkner, Marie Mott, and Don Rudolph for their continued commitment in working together through this pandemic. Mayor Robinson, I want to thank you for your consistency in messaging and for all your efforts and resources that you have allocated to support the safety and well-being of our community. Your Community Health Center will continue to stand with you and do everything we can to support your efforts in the coming weeks and months ahead. Now it's with great honor and pleasure that I introduce to you Gay Nord, the Chief Executive Officer at West Florida Hospital. Thank you.
Good morning. Thank you, Chandra. I'd like to take a moment to express my sincere gratitude to all the healthcare workers, our first responders in our community, certainly for their resilience and dedication to our community and to our patients. We've been through an unprecedented challenges over the last year, and now we're facing those same challenges again. Nationally, approximately 94% of hospitalizations are unvaccinated patients. That same number is approximately true for our community as well. The facts are, the highest spread of cases and severe outcomes is happening in places with low vaccination rates. And virtually all hospitalizations and deaths have been among the unvaccinated. The severity of illness is greater with the Delta variant than compared to last year's strain, as we all know. The Delta variant is 50% more contagious than last year's strain. And the spread of the Delta variant is 1 to 8 people versus approximately 1 to 3 people with last year's strain. The only defense we have to minimize illness and death is the vaccine. And I appeal to you today, as I know all of my colleagues will do the same, to get vaccinated if you have not. The burden on our community and our healthcare system is real. To emphasize the impact on our healthcare system as of today, West Florida Healthcare is rescheduling certain surgeries to reallocate resources and increase our capacity to serve the emergent needs in our community. As we implement surge plans, our focus will continue to be on the health and safety of our community, our patients, and certainly our staff. I appreciate the opportunity to share this information with you this morning. I do applaud my colleagues in healthcare for their leadership. I applaud our mayor for his. And again, I appeal to you to help support us move this forward in a positive way. And now it's my honor to introduce the president of Baptist Healthcare, Scott Raynes. Scott.
Thank you, Gay. And I echo Gay's comments and Chandra's comments. Thank you, Mayor, for this opportunity. Thanks to our first responders and certainly our frontline healthcare workers for the great work that they do each and every day in the throes of this third surge that we're experiencing. I want to talk just for a moment about masking. I want to myth bust maybe a few things about masking. Masking is a tool in the tool belt to fight and prevent. It is a weapon in our arsenal, and it is a tried and true method of safety that goes back pre-1900s that healthcare workers have used over and over and over again. It should be the least controversial of anything that we have to work with regards to battling and flattening the curve with regards to the pandemic. It does not reduce the amount of oxygen that you breathe. It does not increase the amount of carbon dioxide that you breathe. It is a safe, effective way to help flatten the curve and prevent the spread of the infection, not just COVID-19, but all. So I would urge each and every one of you to entertain putting a mask on. It is clearly a way in which we can battle what we're up against. Again, please wear a mask. Additionally, social distance. Wash your hands and do all of those things that we had in our arsenal prior to the vaccination. And finally, I want to talk just a bit and echo again my colleagues that spoke before me and certainly those that will speak after me regarding the vaccination. Consider it. It's available. If you want a vaccine, you can get a vaccine within an hour anywhere within this region and within this community. It is the two-fisted way in which we can fight this fight and ultimately prevail. Masking and vaccination. It's there for us. It's at our fingertips. I would urge each and every one of you to consider it. There's opportunity to learn more about the vaccination. It's safe for 12-year-olds and above. It's free. It's there for you. Masks are readily available everywhere. In closing, I would simply again thank the mayor for the opportunity to be before you and speak today, thank my colleagues that are speaking before me and after me today, and once again, thank those frontline workers that are out there fighting this fight, caring for our community each and every day. Thank you. Now I'd like to introduce Don Rudolph, the President and CEO of Ascension Sacred Heart.
Good morning, everyone. Good morning, Mayor. Thanks for having me today. Great words of wisdom from our healthcare providers today. I would add this, that since July 1st, our COVID hospitalizations have risen 7 times. What was different this time than the last surge is the Delta variant. It is different. It's more contagious, as Gay said, 50% more contagious than the original strain. What that means is that in the original strain, one person would typically share it with 3 other people. With this strain, one person shares it with up to 9 other people. And so with that, we saw hospitalizations go from 2,000 to 10,000 in the state of Florida in the first surge over 60 days. This time, it went from 2,000 to 10,000 in just 2 weeks. More contagious. The second point I'd like to make is that it can break through to the unvaccinated. So Scott's point about wearing a mask is very important. The efficacy of the vaccine is in the high 90% for the COVID-19 virus. The Delta variant has lessened that efficacy just a bit, as it is a mutation of the original virus, but it's still in the high 80%. So that is your best, the vaccination is your best protection against this variant. The virulence of this Delta variant is 1,000-fold higher than the original strain. So we are seeing sicker patients in our hospital, which translates to the mortality rates. I would also add that we're seeing more pediatric patients in Studer Family Children's than we did the first time around. And that's frustrating to our caregivers, knowing that had we used vaccinations to a higher degree here in Escambia County, we would see a less amount of hospitalizations. When I looked at the CDC tracker this morning, 90% of folks over the age of 65 have received their first dose of vaccination. And yet just barely 50% over the age of 18 have received their first dose of vaccination. That explains why our hospitalizations are a younger group. And I would also add that it's the families and visitors' faces that we see as they come into the hospital in a bit of disbelief that this is happening to them. We don't want you to be in that place caring for a loved one with COVID. So please, as we're all appealing to you, please get vaccinated. It's free, it's available, and it's the way we can come together as a community to care for each other. My last point would be to again thank all of our persons that are healthcare workers across this county. The first responders, people in the hospital, people out giving vaccinations, everyone that has stepped forward, to lead this fight. It's a tiring fight. They've taken extra shifts, they've taken on overtime, they've taken time away from their families to care for all of you. And so I want to acknowledge that, and I want to thank them for that dedication to their vocation. We know that this variant came to us, it was first shown its face, I guess, in India, and then moved on to the UK. So scientists have been studying it. We're told it'll be 45 to 50 days or so that it'll be in our community. I don't believe we've hit our peak yet. I'm looking at my colleagues. We still feel that our numbers will escalate. It was about the 3rd week of July when we started seeing the uptick in the trend, and so we can predict out to see where we're going to be over the next several weeks. So in this time, please, again, the appeal to step forward, get educated, get vaccinated, and join us in this fight against COVID-19. Thank you, Mayor, for having me. Thank you, my colleagues that always stand ready with a quick response. We appreciate you, and we appreciate everyone in this fight. Thank you. And now I'd like to introduce the administrator for the Florida Department of Health for Escambia County, Marie Mott.
Thank you, Dawn. Thank you, Mr. Mayor. As has been remarked before by my colleagues, the vaccine is the most effective way to protect against COVID-19. This is a tool that we did not have this time last year, and it is a very effective tool. The COVID-19 vaccines continue to be vital to ending the pandemic, including combating recent national and global increases. Vaccine benefits include significantly reducing the risk of contracting the virus, even if you are exposed, and increasing the body's ability to fight the virus. Includes reducing the risk for those who do contract the virus of experiencing severe symptoms, hospitalization, or death. And includes reducing the virus's ability to spread to others. In the last month in Florida, most cases of COVID-19 have been among unvaccinated individuals. In fact, only about 6% of all cases reported in Florida have been among persons who have been vaccinated. Public health is everyone's responsibility. In addition to getting vaccinated, the best way to prevent illness is to practice tried and true public health mitigation measures, such as getting vaccinated against other preventable diseases, staying home when you're sick, washing your hands frequently for at least 20 seconds, using hand sanitizer with at least a 60% alcohol content, covering your cough or sneeze by using a tissue, your sleeve, or your elbow, avoiding touching your eyes, nose, and mouth, and cleaning and disinfecting frequently touched objects and surfaces. As cases increase, individuals should continue to watch for COVID-19 symptoms, and especially if unvaccinated. And if you develop symptoms of COVID-19, keep your distance from others, be evaluated by a healthcare provider, and get tested. Florida continues to report data to the U.S. Centers for Disease Control and Prevention. CDC data are available at cdc.gov/COVID data tracker. Additionally, the Florida Department of Health's weekly COVID-19 report is published every Friday and can be found at floridahealthcovid19.gov. On that website, you can also find other locator tools for finding testing locations and vaccine. COVID vaccines are currently offered at the Florida Department of Health in Escambia County at 1295 West Fairfield Drive, Mondays through Fridays from 8 a.m. till 3:30 p.m. on a walk-in basis. All authorized vaccines are available, including Pfizer for ages 12 and up and Moderna Johnson & Johnson for ages 18 and up. Additionally, individuals can find vaccine at most commercial pharmacies, primary care offices, urgent care and walk-in centers, and all the locations that our partners today have mentioned in their comments. I encourage those seeking vaccine to call the desired location to confirm hours and availability. I would really like to thank all the partners and leaders who have come together this past over a year to help fight this pandemic. The important thing to remember is that you are part of that partnership also, and your role in this partnership today is to get vaccinated and encourage each other to get vaccinated. Thank you. Mayor?
Thank you. Marie, thank you. Chandra, Dawn, Scott, and Gay, thank you very much for everything that you and your hospitals are doing, and all your staff, your doctors, your nurses, everyone there that is putting in the effort. I think the most critical thing, one of the things we heard today, is this is not just about COVID at this particular time. The most important thing that we've been tracking is hospitalizations, because at the end of the day, hospital capacity is a tremendous amenity for any community, and we're very fortunate to have 3 great hospitals and a community health organization that are working in partnership with the Department of Health. But at this time, they're telling you all 3 of them are going to be taxed. We've hit a record number, and they're starting to look at ways that it's going to impact now the service of those who have nothing to do with COVID. So if you have cancer, if you have heart problems, if you have any number of other issues, your health and access to health care may be compromised by the fact that we have simply so many people that are now in COVID. However, we can do something for not just those people that are having other health issues, but for those with COVID. And the most important thing today is continuing to look at vaccine. I certainly enjoyed my time last week away from here and had a chance to look at some things. But the thing that was most interesting to me, one of the things, I went to a national park, Congaree National Park, which is named after the Congaree Indians. Congaree Indians were actually a thriving civilization that basically existed in that area, had no necessarily problems one way or the other. But by 1700, they were essentially gone. What happened to them between 1600 and 1700? It was primarily disease, and being unable to be vaccinated against common diseases that were coming. Who individuals who had those diseases already, even though they may have picked them up, they had through either their own experience or a variety of other things, they showed different immunity to it than those Native Americans. When I look at those kind of things and I see it, it continues to point back to me that the most important thing that we can be doing here to get through this is to do vaccines. And I think if a 15-year-old can say that and sum up, get it done. What was it? Get your shot so we can get it so we can end it. I think that should be our slogan, all of us. And I think it should be there for all of us. And a 15-year-old is brave enough to figure it out and go take the vaccine. We all can do that. I've taken the vaccine. I know Keith. I know many of our people here. And our leadership staff have done that, and the city have done that, and we've been working. I appreciate some. I know Dawn and Chandra. I know Ted Kircher has been working with you guys to come to City Hall and come to other city facilities so that our employees can get vaccinated. We're very we want them to be vaccinated and protected so they can continue to serve you. But these are the things that we are working through at this particular time, and I highly encourage you to get the vaccine. I think it is something that really all of us need to do. It's really our civic duty to each other to be able to do that. And at that point, again, we're not ever getting over COVID. COVID is going to be here. So thinking that you can just go and it's going to end and you don't have to be a part of that, you are a part of the solution. We will still have COVID, but we won't have to do all the precautions that we're doing now. We're going to be talking today about, do we look at large gathering events that are city sponsored, and how do we do, and we may have to curtail some of those things. So, these are all things that we were really enjoyed for about 4 months. But obviously, the condition that's on us now, we got to reevaluate and see where we are. But I think if we can get it done so you can be done with it, that's what we need to do. I'm happy to answer any questions. I know that I was told that Marie had another meeting she had to go to, but I'm certainly here, and I think some of our healthcare providers are here. If you have any additional questions for them, we'll be happy to take those and answer those as we can. John.
Mayor, I guess this would be more appropriate for the providers, but what would you say to unvaccinated people who say that the mortality rate is so low in this current wave that they're willing to take a risk as opposed to what they believe is an unknown risk with the vaccine?
John, I would tell you a couple of things. One, I'll let them come up here and speak, but the City of Pensacola has never tracked mortality. There's a reason for that. It's not the issue of what we were trying to deal with. The issue we're trying to deal with is what came forward when Gay Nord told you that we may have to schedule different operations. Healthcare capacity is the issue that we're most concerned with. We think it's the biggest community asset that needs to be protected. I can't control who lives or who dies. If you can go get in your car and get killed on a road, most of us drive today very safely, but it can happen to you. So, I prefer not to get into the issues of mortality, but the one thing we do know is our hospital capacity at this point is used up. And there are any number of things, not COVID, that need that hospital capacity. So I would tell them that's the importance of it. The other thing that I would tell that, everybody seems to be becoming social media experts on this, and I enjoyed my time with with my favorite plumber Larry Downs, and at least in yesterday he did acknowledge one thing. It was his information, not mine. He agreed and accepted it on my Facebook page that indeed you are safer if you get the vaccine than if you don't get the vaccine. So if you're worried about the vaccine, it's statistically there, and even Larry Downs admits it. So if Larry Downs admits it, then we know it's right. I think we can all speak to that and that internet sensation. But I'll let any of the providers come forward and be able to speak to what they'd like to speak to about that.
Thanks for the question. I think we all jumped forward. I guess I ran the sprint. I made it this time. I think has an excellent question. It's an ongoing risk assessment, and I think that's why it's important for persons to always confer with their family medicine practitioner, their primary care physician, because as you know, immunocompromised people can have risk, but it's risk versus benefit. And what we do know is that 94%, we've heard as high as 97% of those being hospitalized are unvaccinated. There is a risk being hospitalized. When you're in the hospital, you can degrade and go into a term that they're using now as long COVID. And so those risks have yet to be identified. I think that's one thing that's a little worrisome in the medical community with the Delta variant, is that it's just kind of shown itself. What are the long-term effects of getting that variant into your system? We do know that the vaccine is the best protection because it's not a live virus. It's working off the spike proteins and the antibodies and the T cells that your body's generating from that. So I'm not going to go into a deep scientific view, but we do know that on that first go around, we had pulmonary rehab spikes in those type of treatments because coming out of COVID, there was this long-term kind of effect of contracting the virus. Thank you.
I want to say,
Mayor, we know that West Florida is suspending elective surgeries. What are the other hospitals' policies? Is everyone doing that? And what's the policy for visitors at the hospitals?
We are all in the throes of evaluating what to do with services. Some are a little further along than others as far as making decisions right now with regards to that, but we're all essentially in the same boat. As the mayor said, care is now being rationed, if you will, to some extent because of the challenges that we face in managing the pandemic. We at Baptist have not, at this point, suspended elective procedures, but that is something that we look at on a regular daily basis. From the standpoint of what have we done collectively as a healthcare system throughout the region and partners, we've all reverted back to our previous visitation policies. We've all stood down with regards to our in-person meetings that we had began to open back up. We are essentially right back where we were this past winter. I would like to add just one comment with regards to the previous question. I agree with Dawn. I'm not going to get into national statistics. Gay has shared that, but I can say at Baptist Hospital within our system, Baptist Gulf Breeze and Jay Hospital, throughout with the availability of the vaccine, we have not had one mortality of a vaccinated person yet. Not one. That dates back to March when we would say vaccine was available to any and all. So to this point, we've had 0 mortalities of anyone that's been vaccinated. Looking at the month of July alone, we had ICU admissions on ventilators. Not one person on a ventilator was vaccinated. Everyone who was ventilator cared for was an unvaccinated individual. There is no question an unvaccinated individual with COVID versus a vaccinated person experiencing a breakthrough is more acutely ill, overwhelmingly so. We see that. The evidence is before us. It's in our region. This does not have anything to do with what's going on somewhere else, although it's true everywhere. Okay? Happy to allow my colleagues to speak more. Thank you.
Thanks. And I'll just clarify for Sacred Heart that we have gone to the 1 visitor from our adult side, 1 visitor in the ER, and 2 visitors for our peds and women's hospital, which is back where we were a year ago. And as far as services, we've included alternative staffing, so we have associates that are out on furlough as well. Due to COVID-19, we have no associates that are hospitalized if they're vaccinated. And the only associates across our Ascension, Florida Gulf Coast Ministry, which is 8 hospitals that have been hospitalized with COVID, have been unvaccinated associates. So just another factoid for you. With that in mind, we continue to assess the census daily, surge into alternative areas if needed. We are evaluating our surgical schedule so that we can prioritize emergent and urgent cases. As you know, we're a regional trauma center. We have to keep our doors open for the region, and so we assess that daily. Thank you.
Quick question for you. Can you just talk a little bit about, obviously hospitalizations are a huge deal, about the ICU bed availability right now? I talked with somebody who told me that it seems like the only things left is closets at Sacred Heart. So just talk about that a little bit.
So a couple of things just to reassure the public. The question is about ICU capability. I mean, you really need a complement of things to create an ICU. You need the right equipment, you need the right people, you need the right environment, particularly for COVID patients because of the negative pressure. We are adequately supplied with all of those, and we do have to go to alternative sites if needed. A lot of times ICU patients could be housed, for example, in a post-anesthesia care unit or our PACU. We have the right complement of staff, the right equipment, the right oversight to care for them for a period of time. It's the sustained surge that worries us. At any point in time, we surge as a hospital, and yeah, it may feel like we're in every nook and cranny because our primary goal is to keep our ED flowing because it is an unfiltered type of front door, if you will. And so I just compliment our staff who've been retrained. We have helping hands, we have deputized, we have redone competencies around respiratory therapy. So this has been a proactive, highly detailed plan to surge. We had a lot of good learning during the first sustained surge, and we applied all of those learning tactics to this. So although we are expanded, I feel like overall morale is good, and we are able to take care of the community.
And you talked about the peak, like you guys haven't hit the peak yet. When do you guys project that peak to be, and how much worse could it get?
So in overall census, and of course that's when we include people having babies, little kids, on the overall census, we've had a sustained higher census this go-around since mid-July. So when we look at overall numbers, our beds are been very full. Now in COVID hospitalizations, we actually hit our prior peak over this last weekend. So we're at 100% plus now over prior peak. Okay.
Thank you. And Dad, I didn't know if you want to say anything else, or?
Yeah, just a couple of comments, and then I'll. So as far as West Florida, you heard my comments about surgeries. Obviously, we are assessing that daily. We have certainly decreased our elective surgeries so that we can reallocate resources across the hospital. All of our healthcare systems have activated their surge plans. There is a lot of structure and a lot of work that goes behind that. It's very detailed and frankly is kind of a well-oiled machine at this point. So, you know, from that perspective, we're all in surge capacity. We certainly have capacity, so I certainly don't want the misnomer out there that we don't. But we definitely have ICU capacity as well. So, thank you.
I think one of the things that was interesting, I certainly think when Scott was up here talking about some of the things that have happened, I think when I looked at Contagion, I laughed. You know, that was the one that my daughter told me. She said, "Dad, they did a lot better job over the Christmas holidays of getting out the vaccine." I said, "Well, you can do that in a movie." But I also told her, you know, looking back at that also has been interesting a little bit in the movie. I think most of the things in there, I mean, I was like, I'd never heard of social distancing. I forgot I'd gone to that movie, and they talked about these things, and they talked, and so much of what was in there was really what we were experiencing. Except the one thing I think that we didn't anticipate is that so many people would have such a false narrative about the vaccine and about other stuff. We've been operating on people with masks. I mean, we've been conducting some of the most important surgeries with masks on, and yet exactly. We have people say that somehow or another they're going to faint or they're going to do anything. Now, I'll be the first to admit, if you're out running around, it's hot in a mask. So yes, it's hot, but it doesn't change what's happening. It doesn't change the efficacy of what's there. But I think more the vaccine. I just think it's amazing to think that we've done a variety of things that we have required people to get vaccines for. Like I said before, I went to Mammoth Cave. They were doing tuberculosis. I mean, thank God we don't have to do that anymore. We were out of the vaccines by that time, but polio also, as a Rotarian, that's something we do. We got vaccines. But I do remember getting shots and a variety of things. I still remember the building on North Palafox. That's one of my earliest memories. Is I remember going there to that building when it was still the medical center and getting a shot there. So that's how traumatic shots certainly can be. I understand, but I do still remember that memory. But I know I got any number of things. I got them for my children, dip-tet, a variety of other things. Vaccines are not new. This is not something that just came up here. This is not something that we haven't already eradicated. We have to quit discussing false narratives and really start discussing what are the things in hand. A variety of things that I get to, it's just so funny. I mean, it's down to what is it why won't you do it? Why don't want to be made to do anything? Okay, but let's get through the 3-year-old. That's what I talk to my children. I remember when they were incredibly scared to go out in the water, and they used to tell me all these things. I said, I would keep bringing them further in the water. I said, talk to me. Tell me what it is you're afraid of so I can know. Quit giving me all these other things that are out there. Talk about it. If these are the things that really scare you, then yes, that's fine. That's why, exactly, and 2 of our hospitals are Christian affiliated. I mean, the first thing it says all throughout the Bible is do not be afraid. Again, we are simply trying to find a way to provide something that's going to help all of us and to be able to get through this. And we are not getting through this if we don't all participate in it. So I'd ask you to seriously consider today, if you're unvaccinated, what is it? Verbalize what is it that's keeping you from getting vaccinated. And if you have true fears and concerns, then get with somebody about it. But I would tell you, do not be afraid, because that is the thing that we have to get over as a group as we move forward. And we have to have faith in our community, and we have to have faith in what we're doing, that we will continue to survive as a society. The Congaree Indians, again, were once a thriving, great society. They met a medical pandemic that they were unable to meet and match. I do not want to see the same thing happen to us. And I think we have a number of people. We're very fortunate to have 3 wonderful hospitals in our community, and they all do an incredible job. And all those people that work there do an incredible job. And we are letting them down if we don't somehow figure out a way to get past this. So thank you for your time on this today. Thank you all for coming and being a part of this. And John, do you have something else?
One more?
Yes.
Mayor, a conversation that's trending over the past weekend is those people who got the vaccination in January, early February, a lot of them are asking about getting boosters on the Moderna and the Pfizer.
I'll have to
medical
defer.
Professionals on social media discussing to talk to your family doctor. But could we get some information from these medical
Yeah, they would need to talk to you about that, because all I know is I took the science for non-science majors, so I'm going to turn it over to people that actually do this stuff.
I'll tell you just what I think we all would probably say right now is what we know currently. So there is no approved booster at this point. It is still obviously in phases with the FDA and some of the vaccine manufacturers. So we don't really have any guidance, any definitive guidance on a booster at this point. So it remains to be seen, but a lot of questions about it certainly out there. So thank you for your question.
Mayor?
I would think the good news is it sounds like it is something that is testing is occurring on. So again, it took us about a year to get vaccines. So as these things move along, I think they take time. There are good people doing good work, and I got to believe they're working as hard as they can to try to figure out solution.
If a family doctor tells a patient to go to get another one of these shots, will it be provided? I mean, can they get it?
Are you referring to the booster
Boosters,
itself?
yeah.
Well, I mean, I think, yeah,
Yeah,
I mean,
the-
there is not one currently.
I guess you're asking, do they go back and get the shot, do they go back and get the vaccine again, is what he's asking.
Yeah, I
That-
mean, if
that's
they
not-
already had the vaccine,
I
Yeah,
think,
that's not indicated, and that's not the guidance.
yeah,
To get I think what you're asking is a third vaccine.
correct.
Yeah, no, that is not the indication for the vaccine.
Do you have any reports of people going in and say, I want the initial one, when in fact they're asking, they're really trying to get a third one?
Yeah, I have no reports of that.
Mayor, quick question. Right now, there's not a current breakdown of pediatric COVID-19 hospitalizations. We're hearing more and more of these cases. Any plans to start making these numbers available?
again, our goal is to track hospitalizations and age is, I mean, it wasn't like we were tracking solely for individuals who were elderly. All these things are certainly important. I don't know if Dawn has any numbers or census. I would imagine most pediatric would end up certainly there. And there certainly is pediatrics at all three hospitals. But you know, I mean, we've never deviated off of age. It's been the same thing. It's been important. Anyone who has COVID is important to us, regardless of whatever their age is. So they're all certainly important, and our goal is to work to reduce all COVID cases. So that's what we're going to continue to work with our partners on.
One more quick question. You kind of hinted at it earlier. Any discussions about whether Summerfest will be held in Pensacola in September?
I think we're going to be talking about those things and going forward.
Gallery night this week too. So.
Correct. I did talk with Gallery Night and indicate it might be something they need to reevaluate. I mean, we're doing that as well on city-sponsored items. So again, I think those are things that you will see us adjust on. Things that are private sector issues that we've already given the permits for, I'm a little less. But I mean, certainly if they're city-sponsored, yeah, I think those are going to be things that you're going to see us coming through an evaluation and say it probably is best for us not to hold those city functions. Now, again, if it's a private person, they've already obtained the permit, we'll work with them as we can. I got one here, and then I'll get you.
Some cities across the country brought back the mask mandate, including New Orleans and everything like that. Have you guys talked about that so far?
Oh, we've certainly brought back things masking here at City Hall, and we will continue to do that. You know, from a mask mandate overall, I'm not sure where we go. I know a number of people that I talk to that have not gotten the vaccine have a certain confidence in the mask, and they don't have a confidence in the vaccine. And that's really undermining us. That's continuing to put us in a perpetual situation. I've sat at this podium, and I know, and I appreciate, and I agree all the things. I had no problem doing a mask when it was all I had. But what I don't want to see us do, and this is what we've struggled a little bit, is do we fall on that match crutch and we don't get the vaccine adjusted? Every speaker here has said, get the vaccine. That's what we got to do. Now, if we lived in a world where it was perfect information, perfect decisions, we'd probably be able to say, yeah, let's do the mask and work with that and get there. But you know, if we're not ever going to go to the point where we go get the vaccine, I don't want to discourage people from getting the vaccine. I mean, that to me is the number one way out of this. And we can mask, but mask, even at its best, is a temporary situation that will be. This is the third time we've gone through this, so that's my bigger concern, and why I want to be sure the 50% or the 50% that are unvaccinated are not unvaccinated because they're all just against the vaccine. I mean, there are a variety of other reasons, and we need to make sure we cut out as many of those and get people to understand the importance of going to get the vaccine.
So there are no plans as of right now to re-implement the mask mandate?
Well, I don't really think there's any legal way to do so because of what happened through the state. But you know, even if there was, I don't know that we'd necessarily be there. But so.
Do you have a sense of the participation numbers for the Vaccine Dash event this weekend?
Yes, I'm sure, Chandra.
It was about 100, and 50-50 children and adults. And we were offering the Pfizer as well as the Johnson & Johnson.
Ted? we've had an event. How many people did we have show up for our event?
We had 63 last week, Mayor.
Okay, we've started having, and I appreciate. I think we've been working both with Sacred and with Community Health to get here to our places, and so we appreciate them bringing the vaccine to City Hall. We had 63 people start the vaccine process last week, and we will be continuing to work with that and see if we can get other numbers up. We want to, again, we want to cut whatever somebody has. If they think, I can't leave work, we want to cut that out and figure out a way to get them the vaccine without them having to miss work, do anything else. Any excuse that they might have for doing it, we would love to find a way to solve that for them and give them the ability to go do that. It's important for them and their health, but it's also important for us and what we do at the City of Pensacola. Yes.
Last question. The handling of the virus has become a contentious topic. What do you want the locals to know about your efforts as the mayor?
I think this doesn't have to be contentious. I think we should all be working together on the solution that gets us out of this. I think if a 15-year-old can summarize and say, I understand that we will never be out of this until we all get there and we get done, I think that's the important part. I think it's unfortunate that in the world that we live in, that there are some people who live off misinformation and continue to put it out there, and then it goes. I think we just continue to work with that, but what we really got to do is continue to work together. The enemy is not each other. The enemy is the disease and the virus, and we got to continue to work together. And I think that's been the most challenging. This thing, whether it was a hurricane, oil spill, a variety of other things, it was usually always easy to have everybody working together on the issue. But this one has been much different. It's been hard to get people against a common enemy, which is the virus. Instead, we've been fighting each other over misinformation, and that's been our worst problem. Thank you very much for being here today. I appreciate it. We will continue on with some things that we will do that are just city stuff, and I'm happy to answer any questions because there are a number of city things, but I really appreciate our guests from all three hospitals and Community Health being here today. They are doing an incredible job to keep all of us safe, so we appreciate that. We're in the city. A recycling update. Apparently, in July there was a fire that damage to the Emerald Coast Utilities Authority's material recycling facility. We have been temporarily holding material, thinking that it was going to reopen. At this point, we've been told that it will not be reopening at any time soon, and therefore we are communicating up front with individuals that we will not be recycling in the near future until that can get back open. We've simply were overloaded at this point and can't continue to hold any items. So the tan recycling cans will be collected, but the materials will not be recycled. Recycling is expected to resume in September, but is really dependent upon the repairs of the facility that are completed with the ECUA to accept the recyclable materials. Again, we will still pick up your brown can, but in being transparent with you, we want to let you know that it will not be recycled at this particular time. We do hope that the facility will be back up in September, and as soon as we have word from ECUA when it's back open and we will be collecting recyclables, we will be transparent with you and tell you what's going on. So please continue to tune to the City of Pensacola's website and Facebook page for updates. City ADA sidewalk repair project surpasses 26,000 feet. Again, our Public Works and Facilities Department has repaired approximately 26,940 linear feet of sidewalk and installed 463 curb ramps as a part of the city's 8 Americans with Disability Act sidewalk assessment. That's a significant amount of sidewalk that we've done. I see David and his team out there. I certainly appreciate everything. And Brad with Public Works, thank you guys for what you've been doing. That's great to see that happening, and it's exciting. The city has completed ADA assessment in 2017 and we identified approximately 28,100 linear feet and 2,021 new curb cuts. So we are fast approaching the end of that linear feet number and getting more focused on the curb cuts. Sidewalk repair project are prioritized in a survey that was created, a master sidewalk improvement project list, which is available at the city's website. The target completion date for all the repairs, the ADA sidewalk assessment, is the end of 2023. This is a reminder that today we will have a agenda review on the second floor here in Hagler Mason, and we will have a council meeting on Thursday. I know that many of us, including myself, will not be there this Thursday, as we have the Florida League of Cities in Orlando, so we'll be going to that. I did at least want to update you that the Mayor's Neighborhood Cleanup will be on Saturday, August 28th, in a portion of Cordova Park, Bars Park, Dunwoody Park, and Carpenter Creek areas, as well as cleanup areas. Please see the cleanup map for details. The event allows City of Pensacola sanitation customers to clean up areas and to leave eligible items on the curb for pickup. City of Pensacola Sanitation Services will pick up these items free of charge. For more information, look at the Mayor's Neighborhood Cleanup and visit thecityofpensacola.com. Again, we talked about our hospitalizations earlier, so that's kind of where we are there. If there are other items that you have questions on, please let me know. I'll be happy to answer. Well, thank you very much for being here today. Obviously, the big part was our medical guest, and we certainly appreciate the help and information that they provided. And thank you for being here today and watching.